Hello friends, nice to see you again. Let's enjoy Dr. Y chest radiology. I'm Dr. Y, medical professor, chest radiologist in Seoul, Korea. Today we'll talk about the emphysema, one of the COPD, chapter 43. Let's go. Before entering the session of emphysema, let's enjoy the two wonderful paintings. As you see on the right side, this is Mona Lisa from Da Vinci. This is wonderful, wonderful, wonderfulest painting of the world. And how about the painting or film on the left side? I think this left side chest X-ray painting is much better and healthier and happier paintings ever painted, because she is very healthy and young, no abnormal findings, no abnormal pathology, and very healthy. How do you think about this image? Let's start with the origin of the word emphysema. Emphysema is from the Greek and Latin. It is the meaning of swelling, inflation, filled with air or puff up. That's the meaning of emphysema. The definition of emphysema is like this. Emphysema is a lower respiratory tract disease. Lower respiratory tract is from trachea to the below, characterized by enlarged air-filled spaces in the lung that can vary in size and may be very large. Spaces are caused by breakdown of walls of the alveoli, which replace spongy lung tissue and become large air pockets. This reduces total alveolar surface available for gas exchange, leading to a reduction in oxygen supply for blood. The mechanism is like this. First, over time, inner walls of air sacs weaken and rupture, and creating larger air spaces instead of many small normal ones. And this reduces total surface area of the lung. This reduces also the oxygen amount that reaches our bloodstream and finally to the body tissue. When we exhale, the damaged alveoli don't work properly and old air becomes trapped, leaving no room for fresh, oxygen-rich air to enter. This old man, COPD patient, used to be a heavy smoker, is telling us, insisting us, please stop smoking now. If you continue smoking, you'll become like me. Cigarette smoking. If you do not stop today, there is no tomorrow. This picture is a public commercial of South Korean government health administration. We used to know the name of this disease. COPD, chronic obstructive pulmonary disease. Usually, emphysema person also has chronic bronchitis. Chronic bronchitis is the inflammation of tubes that carry air to our lung, bronchus, which leads to a persistent cough. Emphysema and chronic bronchitis are two conditions that comprise the COPD. Which are the causes of emphysema? I think I know you already know about the causes of emphysema and COPD. Number one, long-term exposure to airborne irritants such as tobacco smoking. This is, as you see, number one. And e-cigarette, cigar, marijuana smoke, air pollution, chemical fumes and dust, and relatively rarely inherited deficiency of a protein alpha-1 antitrypsin deficiency. Before entering the emphysema radiologic findings, I would like to show you the normal anatomy, normal CT findings. This is a lung window setting, thin section CT of the lung. This is normal. What we do see are pulmonary basilar artery or vein or small thin wall of the airway, and all the other black area is normal pulmonary parenchyma. This is normal, and this is the basic structure. Specimen radiography made by the famous wonderful Dr. Ito Harumi et al. In 1993. I'll show you what is parenchyma and interstitium. B represents bronchus, empty tube. A represents pulmonary arteriole filled with blood, and S represents septum, interlobular septum. From interlobular septum to other interlobular septum is about 1 centimeter, and this is usually rectangular or 6 or 5 angles of shape. In the center there is a bronchial and arterial, and the periphery is septum. This is interstitium, and between there are pulmonary parenchyma. This is alveoli, alveolar sac, alveolar duct. This is wonderful findings, wonderful specimen radiography. There are 3 subtypes of emphysema. The famous number 1 is centrilobular emphysema. As the name implies, it starts from the center of the lobule. 2. Perceptor emphysema. It usually starts adjacent to the septum. 3. Panlobular emphysema. Almost all area of the lobule is involved in emphysema, in panlobular emphysema. Centrilobular emphysema and perceptor emphysema being the most prevalent subtypes and often coexist. Maybe these two are the different manifestations of the same disease entity. Let's check the CT findings of 3 subtypes. 1. Centrilobular emphysema. There are small, round, dark areas within central parts of secondary pulmonary lobules. 2. Perceptor emphysema may appear as thin-walled air sacs next to outer part of the lungs. 3. Panlobular emphysema, more uniformly distributed areas of low attenuation throughout the lung. Let's check about the unhappy news about treatment. There is no cure, because alveoli has been already destroyed. Treatment can help reduce symptoms and improve quality of life. Other interventions can help prevent further damage, and new drugs, medicines are being developed for slowing down the progression of emphysema. Dr. David Lynch et al. Classified emphysema on the CT basis with association with mortality in the COPD gene study. That's from the point of CT. To determine whether visually assessed patterns of emphysema at CT might provide a simple assessment of mortality risk among cigarette smokers. The number 1, the mild degree, is mild centrilobular emphysema. Second form is moderate centrilobular emphysema. 3. Confluent emphysema. 4. Advanced destructive emphysema. It goes up and go worse and worse. There is no curative treatment as we see, so we have to go to the prevention. What is the prevention method? Number 1, best one, don't smoke, just don't smoke, as actor Yul Brynner said before. B. Avoid secondhand smoke. C. Wear a mask when with chemical fumes or dust. Don't smoke. Subscribe, Please subscribe and good. Be happy and be healthy. What is the picture on your left side? This is number one beautiful picture of the woman, young woman, healthy, wealthy, and happy image. No abnormal finding. What happened to this centrilobular emphysema? Basically, the lung is taller. Heart is narrower. Pulmonary vessels are smaller, narrower, slender, and scarce. Lung parenchyma is scarce, especially in upper portion. Normal thin section CT of the lung of the young healthy woman. This is normal. Centrilobular emphysema of old man, heavy smoker. Let's compare with a small balloon. This is unused normal, frank, new balloon. It's recoilable. How about this expanded balloon? It has been used 10 times. This is not unrecoilable balloon. This is emphysema. Even lower lobe is the same for this old man. Emphysema, black area of ruptured air pockets of emphysema. This one, everywhere in the lower lobe. And this is normal young women's lower lobe, healthy lower lobe. No ruptured air pocket, just homogeneous low density of normal lung parenchyma. How about this 50-year-old man's advanced centrilobular emphysema? On your right side, we see the CT, thin section CT of lung. No normal alveoli, no normal structure of lung parenchyma, or air-filled pockets without lung parenchyma, or everywhere, almost everywhere of his upper lobe is filled with ruptured air pockets, not normal gas exchanging alveoli. So he has dyspnea. This is his chest X-ray, especially upper lobe. Let's look at the upper lobe. Very scarce parenchymal tissue, fine line only, no alveolar parenchymal cells. Lower lobe is slightly better than upper lobe. Usually upper lobe is more damaged. On this coronal CAT scan, we can see the distribution of the damage of the emphysema. Upper lobe is more prominent. And lower lobes are relatively less damaged. This is 45-year-old man's chest CT of upper lobe. You see that at the periphery, not in the central portion, at the periphery, there is emphysema. This is perceptor emphysema. Do you see the bolus change at the periphery of this lung of upper lobe? Yes, this is perceptor emphysema from smoking. COPD usually has chronic bronchitis and emphysema combination. This is 75-year-old man. The airway bronchus is irregularly thickened and narrowed, showing chronic bronchitis. On your left side also has irregular, narrowed, thickened bronchial wall. This is chronic bronchitis. And we can see almost whole area of empty black air pockets of emphysema. These are all emphysema. So he has chronic bronchitis and emphysema combined. So he has COPD. There is another disease named after another disease combination, combined pulmonary fibrosis and emphysema, CPFE. Because emphysema usually involves upper lobe and pulmonary fibrosis, interstitial lung disease begins from the lower lobe. We see upper lobe emphysema, lower lobe interstitial lung disease. So we sometimes call this disease name as upper lobe emphysema and lower lobe fibrosis. Now you can understand and make it clear of upper lobe emphysema and lower lobe honeycomb lung of CPFE on chest X-ray. You are now excellent in chest radiology. Congratulations. These are same patients' CAT scan, upper lobe emphysema, lower lobe fibrosis of honeycomb lung. Trinity is a holy name, Holy Trinity, but sometimes we describe from smoking, trinity. Emphysema, one is emphysema, second is interstitial lung disease, third is lung cancer in this 66-year-old man of heavy smoker. We see emphysema here and bone rib destruction and mass on his left upper lobe. This is lung cancer invading rib. And this is emphysema on the upper lobe thin section lung window setting CT. Emphysema here and contrast enhanced axial CT. We see lung cancer also here invading the rib here. On his upper lobe we see panlobular emphysema, paraseptal emphysema, and on his lower lobe posterior portion honeycombing of ILD. So this is the trinity from smoking. In this 75-year-old man, we see pneumothorax on his right side. Pneumothorax, spontaneous pneumothorax of old man is mostly from emphysema. Emphysema is #1 cause of spontaneous pneumothorax of old man. Sometimes we see large bulla, giant bulla, like this man on his right upper lobe. We call in this case bullous emphysema. Now the session of emphysema is over, and please let's have a few more seconds to enjoy the beautiful, healthy, normal young woman's both lung on chest X-ray and CAT scan. How beautiful and how healthy are they? I think these healthy lungs are more beautiful than the Mona Lisa of Leonardo da Vinci. Don't you agree? Emphysema is also from smoking, like lung cancer is from smoking. Sir, you quit smoking today? Bravo your life. Thank you very much and see you soon.